Hi, I'm Dr. Marissa Joseph, and here's your module on Molluscum contagiosum. I have no relevant industry disclosures. By the end of this module, you should be able to describe the clinical features and presentation of Molluscum contagiosum. You should also be able to describe the typical natural history of Molluscum contagiosum and also describe the typical populations that this condition tends to affect. So let's again begin with morphology as we always do in dermatology. And we note on this infant there are a number of discrete papules. You can see that these are umbilicated papules. So the answer to our initial quiz is B, umbilicated papules. This is how we would describe these lesions as opposed to just general papules without umbilication, the tumor that we saw in a previous module, macules or vesicles. So Molluscum contagiosum is very common in children. That's the population we tend to see it the most. It's caused by a pox virus and it's self-limited, and it takes about 1 to 2 years to resolve. The clinical features of just what we've highlighted, what's pathognomonic, are the fact that they are multiple discrete small flesh-colored to translucent dome-shaped umbilicated papules. So are children the only patients that are affected by Molluscum contagiosum? The answer is no. So there are 3 groups of people that are primarily affected. So first, young children, as we've discussed. But the second clinical scenario is with sexually active adults, where they may experience molluscum as a sexually transmitted infection. The third important population is immunosuppressed individuals, so such as people who have acquired immunodeficiency virus or HIV. For clinical pearl, when you think about molluscum, you should think about children, STIs, and HIV. So when we look at Molluscum contagiosum and patients who have HIV, their molluscum is very different in the sense that there are still the umbilicated papules, but there's many more lesions. They tend to coalesce and be on top of each other. And why that's important is a patient may not know their immunosuppressed status, but when we see molluscum in this presentation, it makes us think that perhaps this patient may be immunosuppressed, and we might investigate them for that. So in terms of management of Molluscum contagiosum, most of the time we don't do anything, no active intervention. There are destructive treatments such as liquid nitrogen, cantharidin or blister beetle juice, or podophyllin and acid, but all of these are destructive methods and can lead to blistering and scarring of the skin. The other thing to note about molluscum is that they often get a secondary eczema around the molluscum, and that eczema we also will treat with topical steroids. So the key messages today are that Molluscum contagiosum presents as umbilicated papules, and this condition is primarily seen in children, in sexually active adults as a sexually transmitted infection, and immunocompromised individuals such as with the case of HIV. Molluscum contagiosum is caused by a pox virus, and the natural history of molluscum is that they self-resolve. So by now, you should be able to describe the clinical features and presentation of Molluscum contagiosum. You should also be able to describe the typical natural history of Molluscum contagiosum. You should also be able to describe the typical populations that this condition tends to affect. This is the end of your module. Thank you for your attention.